As a woman in her 30s, the last thing Kimby Jagnandan expected was a heart attack. But when it happened, she couldn't have been in a better place: the hospital. Kimby was a patient at Dr. P. Phillips Hospital in recovery from an emergency gallbladder surgery when she suffered a massive heart attack.
I had no clue what was happening. I just knew something was wrong. I was asking for help. I was asking questions. The nurses and doctors were asking me if I had a heart condition. They were asking me if I had a problem with my heart.
Most people think of it as chest discomfort, a tightness or squeezing in the chest, but actually many people don't have that symptom at all. Some people can have what our young lady had, which was shortness of breath, nausea, shoulder discomfort. So multiple different symptoms can occur, and in fact women tend to have much more unusual symptoms or not the typical symptoms we think about. Luckily, her physicians recognized this as a heart attack and quickly got her to the heart catheterization laboratory,
where doctors discovered a blockage and treated her with a balloon pump and stent. After her hospital treatment, Kimby continued her recovery at the Orlando Health Heart Institute's cardiac rehabilitation program. While in the program, Kimby learned about important nutrition changes and exercise habits.
I've had to change my eating habits. I've eliminated fried foods. I've eliminated cheese from my diet. I'm eating more fruits, eating more vegetables.
Cardiac rehab helps patients safely return to an exercise routine and learn about healthy food choices.
Studies show that patients that have participated in an outpatient cardiac rehabilitation program have about a 20% decrease in their mortality after a coronary event such as a heart attack. Exercise is definitely a big part of modifying a lot of the risk factors associated with heart disease, so it's very crucial for them to participate in an exercise program and know what their risk factors are individually so that they can prepare themselves, for the future to hopefully keep their heart nice and healthy.
Recently, Kimby completed her first mile without stopping, getting closer to her goal of running a 5K. Like with Kimby, heart disease and its symptoms are not on the minds of many women.
I think it's important that I use my experience to help others, because when my heart attack happened, I had not been aware that heart disease was the #1 killer among women. And I would like to help spread that message to get that word across to women of my age.
We see more mortality in younger patients because they don't seek medical attention. They think this can't possibly happen to me. And medical workers often don't identify them as quickly as they can because we don't think often of heart disease in younger women.
Looks can be deceiving. You can look perfectly fine, epitome of good health, and yet you're at risk for having a cardiac event. And that's why it's so important that you and your family physician are aware of what the cardiac risk factors are.
As a heart attack survivor, Kimby has become a new voice in raising awareness about heart disease in women and brings a different face to what many see as an older man's disease.